everyone, I'm Lucy Rangas, a caregiving student from St. Agustin School of Nursing, Iloilo. And today, I will be performing range of motion exercises. Exercises that are performed by patient himself or by a nurse in case of helpless patients to mobilize all joints through their whole range. Range of motion exercises are those in which a joint is moved through its full range of motion according to its capacity. There are two types of range of motion exercises, the active and passive range of motion exercises. The active range of motion exercises, which is done by the patient himself, and the passive range of motion exercises, which is done with the help of assistant and from another person. The purposes of range of motion exercises are to increase muscle strength and endurance, to maintain normal physiological function, to prevent complication caused by immobility like contractures, to improve patient participation in activities of daily living, to improve physical activities, and to increase joint flexibility. There is no necessary equipment needed for this procedure, but we can use non-sterile gloves and other PPEs if needed. First, I need to perform hand hygiene and wear gloves. Then, identify my client and explain the procedure. But first, I need to introduce myself. Good morning, sir. My name is Lucy Rangas and I'm your caregiver for today. May I know your name, sir?
Ryan Harris.
Can I see your husband, sir? How are you feeling today, sir?
Good.
Okay. Today, I will be performing a range of motion exercises. This is done to increase your muscle strength and endurance, to maintain normal physiological function, and to increase your joint flexibility. Is that okay with you, sir?
Yes.
Okay, thank you. Provide privacy by closing windows and doors of the room. Place the bed in an appropriate working height. Adjust the head of the bed to a flat position or as low as the person can tolerate. Okay? Stand on the side of the bed where the patient's body parts or joints are to be exercised. Okay? And then, lower the side rails on that side, leave in place. And then, uncover the only part of the limb to be used for the exercise. Perform the exercise slowly and gently manner and providing support by holding the areas on the proximal and distal to the joint. And I will repeat each exercises 2 to 5 times, but in these procedures, I will just repeat 3 times. Stop the movement if the patient complains of pain and if I made a resistance. While performing the exercise, I will begin from the head and I will move down on one side of the body at a time. And then I will encourage the patient to perform as many as the exercises by himself if possible. So first, the flexion and extension of the head. Flexion, extension. So we're going to do this, the exercise, to our client. And repeat 3 times. 1, 2, 3. Next, a lateral flexion. Left lateral flexion, right lateral flexion. 1, 2, 3. Then rotation of the head. Left rotation, right rotation. Okay? 1, 2, 3. Then next, the flexion and extension of the arm. Flexion, extension. So 1, 2, 3. Then next, the abduction and adduction of the arm. Abduction, adduction. 1, 2, 3. Then next, the internal and external rotation of the arm. External, internal. 1, 2, 3. Then the flexion and extension of the elbows. Flexion, extension. 1, 2, 3. Then next, the supination and pronation of the hand. And then the radial and ulnar flexion. So first, the supination and pronation. Supination, pronation. 1, 2, 3. And the radial and ulnar flexion. Radial, ulnar. 1, 2, 3. And then next, the flexion and extension and hyperextension of the wrist. Flexion, extension, hyperextension. So 1, 2, 3. And next, the flexion and extension of the fingers. Flexion, extension. 1, 2, 3. Next, the abduction and adduction of the fingers. Abduction, adduction. 1, 2, 3. And then next, the opposition of the fingers. Okay, sir? Please follow me. 1, 2, 3. Okay, thank you. We will move on for the lower extremities. So I will just expose the leg to be used. So first, the flexion and extension of the legs. Flexion, extension. 1, 2, 3. Then next, the abduction and adduction of the legs. Abduction, adduction. 1, 2, 3. Then next, the external and internal rotation of the leg. Internal, external. 1, 2, 3. Then next, the flexion and extension of the knees. Flexion, extension. 1, 2, 3. Now for the dorsiflexion and plantar flexion. Plantar flexion, dorsiflexion. 1, 2, 3. Then next, the inversion and the eversion. Inversion, eversion. 1, 2, 3. Now, the flexion and extension of the toes. Flexion, extension. 1, 2, 3. And then the abduction and adduction of the toes. Abduction, adduction. 1, 2, 3. And then I will repeat these exercises on the other side of the bed or the other side of the body. And then when finished, we will make sure that the patient is comfortable with the side rails up and the bed is in the lowest position. So, sir, are you feel comfortable?
Yes.
Thank you for your cooperation, sir.
Thank you as well.
You're welcome. After done performing range of motion exercises, remove the gloves and other PPEs if worn, and then we will perform hand hygiene. Document the exercises performed and any significant observation and the patient reaction to the activities. So that would be all for the providing range of motion exercises. Thank you and have a good day.